Doctor, do you still do FUT? Is it still useful in 2025? Why is nobody doing it? Why is everybody speaking of FUE? These are some of the questions that we have faced in the last few months. And to discuss these topics, I am Dr. Venkataram Mysore, Dermatologist, Hair Transplant Surgeon, Venkat Centre for Aesthetic Health, Banashankari, Vijayanagar, Cunningham Road, Bangalore. Now, let us just look at what is FUT. As you can see here, FUT involves taking a long strip of skin from the back of the head, as you can see here. About 1.5 centimeters wide, 18, 20, 25 centimeters long. That is taken out. That gap is closed with a stitch. The stitch looks like this. Then that piece of skin is kept under the microscope, as you can see here. The strip is separated into individual units which are arranged like this, and then those are implanted. This in brief is the process of FUT. This was the main method of transplantation almost until 2008-2009. Then FUT started becoming more popular, and till by about 2013, 14, 15, it had become more popular, and in the last 4-5 years, it is the predominant method. FUT is now only 10% of all transplants done. 90% is FUE. Why is this so? This is because FUT created 3 types of fears in the patients of mind. One is the stitch itself. Stitch, people are afraid. And stitch takes 2 to 3 weeks to go. So there is some discomfort for 2 to 3 weeks. That pain also caused fear. And finally, when it heals with a long line scar like this, as you can see here. Because of this, FUE became popular because FUE heals fast within just 1 day. There is no linear scar and patient is comfortable. But 2 things, pain, discomfort and the time of healing is longer in FUT. This has to be accepted. But the scar is not necessarily the case. You can see here, this is a bad scar. This is what causes fear. We are going to put up a video now. See this video. The donor scar after FUT. Hardly visible. Excellent healing. You can just not make out a scar. So, with proper skill, with proper experience on the part of the doctor, scar is not an issue. But FUT is a more difficult method to learn. It takes a couple of years to learn it properly. It also needs a large team of 8-10 people. For these reasons, doctors also don't wish to learn it these days. So FUE has become the main method because of these reasons. Now let us look at the question, does FUT still have a place in 2025? Yes, it does. I will give you 3 or 4 different situations. Situation 1, a large bald area and the donor area here is only limited donor. If you do combination HT, which is FUT and FUE, in such patients, you are able to harvest a larger number of grafts. 5,000 can be harvested by combining the 2 methods. So this is one situation wherein FUT has definite value. Second, supposing the patient doesn't want to harvest from the beard or has very poor chest area. His only donor is in the occipital scalp. Then there is no option. In such a situation also, FUT adds value, you can add more grafts. The advantage of FUT is that you get a large number of grafts, up to 3,000 grafts in one place, one strip. Then you are leaving the area above and behind that strip, as you can see here. That is used for FUE. One FUE and a second FUE. So over a person's lifetime, you can harvest 7,000 to 7,500 grafts in such a situation. There is a third situation. You look at this photograph. This is called reverse pattern hair loss, wherein the baldness is climbing up. There is no scope for doing FUE in such a patient. The only scope available is FUT in him. So that is another situation. And finally, a very young patient, 22, 23, who has significant baldness. You don't know how far he is going to be bald, whether he will need 2 sessions, 3 sessions, 4 sessions. In such a situation, doing FUT as a first session will leave rest of the donor virgin for future prospective hair transplants. So these are the 4 situations wherein FUT still has a value. So patient should not be afraid. Now the issue is that there are not enough clinics wanting to do FUT because it's a tough technique. But hair transplantation is a very small field. It is not like cardiac surgery wherein you have 20 different techniques. In that, doctors should not be choosy that I will not learn this, I will not learn that. A doctor should be proficient in every method. That gives him the best option to treat every patient depending on that patient's requirement. So my suggestion to patients is that where it is needed, FUT is of great value. Choose a clinic which is capable of doing all the techniques. Coming to our center, we have 2 plastic surgeons. I am a dermatologist. We have a facial plastic surgeon. We have other assisting doctors. And so we have all the expertise needed to do whatever method, whether it is scalp hair, beard hair, body hair, FUT, FUE, long hair, anything. So one should always go in for such a center wherein such expertise is available so that the best can be done for that particular patient's requirement. One last issue, FUT, the hair is taken from the absolute center. This is the safest of the safe donor area. This area is called safe donor. But what is safe is what is in the center. As you go away from the center, above or below, as you can see in this, above or below, the androgenic process sets in. So when you do FUT, you get the absolute safe area, safe hairs, which is the best hair for any transplantation. So I hope you have liked this video. Please share this video. If you have any suggestions, please give us. Visit venkatcentre.com. Thank you very much. Namaste.